Welcome to Learn with Livanta. Medicare, the BFCC-QIO, and you. Livanta's podcast where we bring you up-to-date information about QIO services and the overall Medicare landscape. This month's episode is themed around health literacy, as October is marked Health Literacy Month, a time to recognize the importance of making health information easy to understand and the healthcare system easier to navigate. The CDC defines health literacy through two different lenses, personal and organizational. Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. To begin, we're going to share a case study where discharge planning and personal health literacy are at the forefront, and then move into a guided panel discussion focused on health literacy with Lisa Novak and Catherine Wiley, two leaders in the communications department here at Livanta. The true-to-life story you are about to hear is based on stories of Medicare patients, families, and caregivers. The services that we provide at Livanta, including the appeal process, help to resolve barriers to care, inspiring hope and confidence that those in need can successfully navigate their care. Any resemblance to persons living or deceased is coincidental unless otherwise stated.
Mom has lived on her own since Dad died a few years ago. She's done pretty well taking care of herself, but when Mom had a heart attack, it turned our world upside down in a matter of minutes. I live a couple of hours away from her, but I try to visit when I can. Between work and raising my own kids, it's difficult to get away sometimes. The morning she'd had her heart attack, I left my kids with a friend and made the trek to the hospital. Fortunately, Mom was stable and released after a few days. She was lucky. It could have been much worse. I stayed for the couple of days that Mom was in the hospital, but I had to get back to work and my children. As a single mom, I simply couldn't stay with Mom any longer. When she was discharged, she was able to have a friend take her home. After that, I talked to her on the phone every night to make sure she was doing okay. Mom had always been on top of things, so I didn't think to double check her this time to make sure she had what she needed. That is, until Mom ended up back in the hospital a few days later. She'd had another heart attack. Mom's neighbor called and woke me up. The second heart attack was minor also, thankfully, but I was worried all the same. I made the 3-hour drive back to the hospital in the early morning hours. The darkness and occasional pair of headlights were my only company on the road. When I arrived, Mom was still in the emergency department. Behind her curtain, the lights were turned down low due to the late hour. I quietly took a seat in her room. As I sat in her hospital room listening to the beeps of the machines and voices of nurses and other staff in the halls, I couldn't help but wonder, how did Mom have another heart attack so soon? Didn't they give her new medicine and tell her to watch her diet? Did she overdo her activity level? Exhausted, I started to doze off in Mom's dark hospital room, just as the doctor walked in. I shot straight up in my chair, ready to hear what he had to say. The doctor started asking Mom questions about her medications that had been ordered when she was discharged a few days ago. He also asked her what her day-to-day routine was after she had returned home. It was during this conversation that I learned that Mom didn't understand the instructions for her new medications. She had taken most of them incorrectly, either at the wrong times or the wrong dosages. Some of them she hadn't taken at all. Plus, she didn't seem to understand her heart-healthy diet and the need to not overdo physical activity. So here we were again, another heart attack, another hospital admission. I couldn't understand how this happened. Hadn't anyone given her instructions about all the new medications she was prescribed? What was going to happen when she was discharged this time? What would be different this time? I sat in her room as she slept, questions swirling through my mind. What now? I thought. There has to be a solution, right?
I am joined today by Lisa Novak, Livanta's Associate Vice President of Strategic Communications.
Hi, Noah. Thanks for having us here today.
and Catherine Wiley, who is Livanta's QIO Communications Director.
Hi, Noah. Excited to be here.
Together, Lisa and Catherine have 50 years of combined experience in healthcare, communication, and marketing, and have unique perspectives on the intersection of these topics as it relates to patient care. Lisa's background includes a bachelor's degree in communications and mass media, as well as a master's degree in organizational behavior and executive coaching. Her credentials include being a licensed nursing home administrator, licensed practical nurse, and board certified patient advocate. Catherine holds a master's degree in business administration and an undergraduate degree in journalism. She has also held roles in long term care and public health and specialized in crisis communications. Both Catherine and Lisa are passionate about communication in the healthcare space and the incredibly important topic of health literacy. As communication leaders for Livanta's QIO services, Lisa and Catherine are champions for the use of plain language in making information accessible and understood by everyone. Can you explain what discharge planning is and discuss why it is such an essential part of someone's healthcare experience?
Sure. So a discharge plan is really just a written piece of paper, right, that the hospital gives a patient when they go home. And the discharge plan has the written instructions to help the patient with their recovery. So really, when a patient is at risk for having, either complications or an adverse outcome after they leave the hospital should be giving them this written discharge plan. So the plan should have information about their medications, which medications to take, how much should they be taking, when should they be taking the medications. The discharge plan should talk about any special diet the patient should follow, any instructions about, what is a safe activity level for them. It should have any reminders about upcoming appointments or any lab tests they should complete. It should have information for whether they should be monitoring any kind of vital signs at home. So, should they be taking their blood pressure every day and keeping an eye on that? Should they be weighing themselves every day? A discharge plan should have instructions for any kind of equipment or special services they should be getting after they leave the hospital. And then any, clear instructions for how to monitor their symptoms. So, what should they be watching out for, and how to know when they should call the doctor or go back to the emergency room. So that really is what a discharge plan should be, the instructions for going home.
Also, too, when you're looking at discharge planning, you should also look at connecting people at community resources with community resources. Things like Meals on Wheels if they have been sick and aren't really able to cook for themselves, transportation to different appointments in case they can't drive. The goal ultimately is to reduce risk for readmission. So ensuring that they have the things in place that they need, in addition to understanding their medications and what next steps need to look like.
So, thinking back to the story that we just heard, could you discuss how it illustrates that discharge planning process that involves both the healthcare facility, the patient, and the family?
Yeah, so Noah, the story that we heard was really written from the family member's perspective. So it didn't really describe what the patient's discharge process entailed during the first hospital stay. So we really don't know what that discharge plan included. When the patient was being discharged the first time, was the discharge plan adequate? We simply do not know from this story. What we do know, though, is that the patient returned to the hospital a second time with having a second heart attack. So would this have happened anyway? Was her health, really that fragile that a second heart attack was inevitable? Or was it the case that the patient maybe didn't understand how to best take care of herself after leaving the hospital the first time? And that's what contributed to her worsening health. From the story, we really don't know, but did she maybe not follow the medication orders that she had been given? What we do know is that she should have been given a discharge plan and someone should have talked with her about it.
So it really sounds like we're talking a little bit about health literacy here. And we all have an understanding that health literacy is important. This month, October, is Health Literacy Awareness Month. And I really want to talk about how the patient's health literacy might have impacted this discharge process. But before we really get to that, can we just step back a little bit for our listeners and discuss what is health literacy? Can we give some additional potential examples to help us better understand why it's so important, especially during the discharge process?
Sure, Noah. So health literacy is essential because it's the degree and ability for an individual to really know and understand the information that's being presented to them about the health services they receive to make informed health decisions and to take action in regard to those things in regard to their health. So understanding information like what's presented in their plan and being able to comprehend it and read it when they go home, being able to understand what their their medications are and how to take them, understanding their treatment plans, being able to understand the risks and benefits of the treatment and how to follow those things in such a way that allows them to make good health decisions overall. And the challenge with low levels of health literacy is that people also often experience worse healthcare outcomes and increased risk of readmission or mortality for that matter. When you really don't understand what's being said to you, it could really be to your detriment. A good example was a story I read about a patient. She was told to follow up at her local community health center after her hospital admission, and they asked her why was she admitted to the hospital, and her response was, I had a really bad cold. This lady was 54. She was, in not great health, but she was admitted to the hospital for pneumonia and congestive heart failure. So those are huge differences in terms of having a cold versus what really was happening with her. So the reality is it's important for people to understand what's being explained to them about their health and how to act in regard to that.
So now thinking again back to that story, how did the patient's health literacy impact the discharge process? In this case, multiple discharge processes.
Yeah, sure, Noah. So not only should patients be given a discharge plan, but as Catherine alluded, they should also be able to understand it. They have to understand how to take care of themselves once they leave the hospital. In the story we heard, all the questions that the patient's daughter asked at the time of the second hospitalization are questions that ideally the patient would have asked and gotten answers to the first time she was discharged. What medications should I take? How much should I take? When should I take them? Do I have any dietary restrictions, like limiting my sugar intake or not adding salt to my food? Those are all the questions that should have been asked during the first hospital stay. And as we said, we don't know for sure what that looked like because we didn't have that perspective in the story. But unfortunately, when somebody is in the hospital, they are typically unwell and not feeling their best. So being in the hospital is not an opportune time for anybody to be able to learn new information. So when you're sick, you just, how much can you take in new information? Sometimes that's very limited if we're not feeling our best. So new information about a diagnosis, new information about how to stay healthy, new information about what to do, activity wise. For example, if you've just had a hip replacement, there are certain movements you should not be taking, with your new joint. So a lot of that kind of detail is given in the discharge plan. And if you don't understand that discharge plan, you are more likely, to have an adverse outcome.
And also in the story, one of the things we don't know was if the discharge planner checked to make sure the patient understood their discharge notes, that they understood what the plan was. And often when you're working with older adults, if they have chronic health conditions, things like chronic COPD, those kind of things that are debilitating, or if they have multiple illnesses and they're dealing with those, again, like Lisa's point, they may not feel their best when they're hospital, so they may not be able to fully comprehend what the plan is. So this is a good time to have someone that's a friend, a family member, a caregiver, a support person with them at the hospital so that they can listen to the discharge plan as well and and ask questions that maybe they don't think to ask. Um, that's a good way to ensure that the patient understands what the plan needs to be and how to care for themselves after they leave the hospital. It's all those things that really fall under health literacy that make it so important as people are discharged from the hospital.
Thank you both for doing a really great job illustrating those deep connections between discharge planning and health literacy. I'd like to take a turn towards the work that we do here at Livanta. What role does Livanta play in the discharge process?
So, Noah, one of the most important things that Livanta does is protect the rights of patients who are being discharged from the hospital. hospitalized patients have the right to appeal that hospital discharge. And Levance's role is to review the medical record when that appeal is being made. So this applies not only to a hospital discharge, but also to other settings of care when Medicare patients are having their covered services being cut. So, in a skilled nursing facility or home health agency or other settings, we can actually review their medical records to make sure that that discharge decision is appropriate. So in those cases, our physician reviewers are looking at the patient's medical records to make sure that that discharge process and that discharge decision is in fact appropriate. So sometimes, even though a discharge is appropriate, a patient may need more support to be able to return home. And for those folks, we also have an advocacy service. So the job of our advocates is to work with the Medicare patients and the hospital or the other care provider to make sure that their needs are really being met after they are discharged.
What can healthcare providers do to support the health literacy of patients?
One of the things healthcare providers can do now to help with patient health literacy is to use plain language, not use jargon, but ensure that they're using short, simple words and sentences that people really understand and comprehend. Maybe even ideally on a fifth to sixth grade level. They need to maybe develop patient materials that are very helpful, that have diagrams that are easy to follow and understand. And with the goal being to ensure that the patient understands what they're being told. Also, the teach back method is another good way to ensure that patients understand. So you're working with the patient, you explain them something, have them explain it back to you so that they understand and can tell you exactly what they're supposed to do. There are other things that need to be considered too. Asking open-ended questions to ensure that the patient can answer. Um, Being culturally sensitive. Consider that maybe they need materials that they'll understand in a different language, or having someone there that's a medical interpreter to help them understand what they're supposed to do. And then ensure that their staff is trained on how to engage with people. And then also digital literacy. Consider that if the patient does have digital access, that they can get information that way. So, but then too, they need to watch for warning signs. If a patient is not following up, if they're missing tests, if they haven't followed up on a referral, or they're missed an appointment, if they haven't gotten a prescription filled, or if they don't really understand how to take their medications, those are signs that there needs to be more education done with the patient to ensure that they're going to get the best results possible.
Yeah, great points, Catherine. And I would add, just another note about, teaching patients about their medications. One of the clearest warning signs for somebody who might have low health literacy is that they don't know the names of their medications and instead might talk about that little round white pill that I take for my blood pressure. Well, you know what? There are a lot of little round white pills. The size and description of pills are not unique to, each medication. So from that standpoint, it would be easy for a patient to get their medications mixed up and take the wrong little white pill, right? Because they, often look so similar. So not being able to, describe your medications by name or dosage is a clear indication that, you know what, this patient may need a little bit more education, or just double checking that they do in fact understand what their medications are. Getting medications mixed up can, have very severe and sometimes even fatal consequences. So really important indicator, when it comes to people's medications.
Now I want to turn to the patients themselves. How can patients advocate for themselves and support their own health literacy?
Yeah. So Noah, this is a question, I guess, that's very near and dear to all of us. But I think the message here for everybody is take ownership of your health, take ownership of your health care. If you're not asking the question, who's going to ask it for you? Right. So, we can talk a lot about the importance of having a family member with you in the hospital or an advocate. But the bottom line here is that if you have questions, you need to ask them. Somebody needs to be asking the questions. I, had the experience of being with my mother in, many of her hospital stays. And, I was right there at the bedside asking questions of her medical team. So if the patient is able to do that themselves, that's great. If not, somebody, really can play an important role to be there at the bedside with them, especially when it comes to the discharge process. So ask questions about the discharge plan. If you're not sure how something should work, ask your nurse, ask your doctor. If you didn't get a discharge plan, ask for a discharge plan. Many patients don't know that they can even ask for one if it's not presented to them first. So, bottom line here, if you have concerns, speak up. Don't wait until you're already having a worsening of your health or worsening symptoms before you start asking questions. In fact, one great way to be prepared is to have a list of questions ahead of time. So, before your next doctor's appointment, think about the questions you want to ask. If you're in the hospital, and you're maybe waking up after your afternoon nap or something, and you've got a question on your mind, write it down so that when the nurse comes in, you remember to ask, or when the doctor comes in, you remember to have that conversation. So for me, that's the most important thing is to, be prepared to ask questions, be ready to ask questions, and be willing to ask the questions.
And then also too, I'd like to add a couple of things. I think a lot of times when we talk with medical professionals, we assume that we should just take whatever they say and do exactly what we're told. But if we really don't understand, or we think we understand, we're not sure, there's nothing wrong with asking that check-in. So don't assume you understand something if you can't really repeat it back. Don't be passive. This is the time to get the information that you need, because this is your health. Um, and don't, if there's a lot of information, don't overwhelm yourself. Be sure to ask very focused and detailed questions, and only ask for information that you need clarity on, to ensure that there's no harm that comes to you.
Thank you both for your time today. We've had the opportunity to have a really good discussion about both discharge planning, health literacy, and Livanta services. I'd love to give both of you the opportunity, if you have any last things to share with our audience about any of the topics that we discussed today.
If you have a discharge question or problem with your healthcare, call Livanta. Our role, once again, is to help people who are having problems with their care. So we have our helpline numbers published on our website. People can always call 1-800-Medicare and get pointed to us as well through that route. So call us. We're here to help you.
Thanks again for your time today. This is just the start of conversations on Learn with Livanta about topics important to Medicare beneficiaries and their caregivers and healthcare providers. Tune in next month for an episode focused on Livanta's immediate advocacy service. For more information about Livanta and to find your state or territory's helpline number, visit our website at www.livantaqio.cms.gov. That's LIVANTAQIO.cms.gov.